transforming leadership culture to improve staff mental health and patient outcomes. Nassau University Medical Center Psychiatry Department at a glance. Staffing. We have one of the largest behavioral health providers in Nassau County. Multidisciplinary, includes psychiatrists, psychologists, psychiatric nurse practitioners, physician assistants, social workers, mental health counselors, and administrative staff. Teaching hospital. We have numerous psychiatry residents, psychology interns, and social work students on staff. We are this diverse staff and patient population, which is reflective of Nassau County and surrounding communities and their various cultural and socio-economic differences. We provide services in a variety of languages to best serve our immigrant and underserved populations. Our diverse workforce has been a strength in our cultural competence, but has also led to opportunities for further training in equity, inclusion, and communication. We offer clinical services. We have inpatient psychiatric units, which provide acute stabilization services. We also have outpatient psychiatric clinics, medication management, psychotherapy, and integrated care. We also offer specialized programs that focus on child and adolescent psychiatry, geriatric psychiatry, addiction, and emergency psychiatric services. Despite our strengths, we face major challenges. High turnover disrupts continuity of care and adds stress to remaining staff. Leadership styles vary widely, leading to inconsistent expectations and communication. Staff morale remains low, while burnout is common, and our current leadership training is transactional and limited. These issues threaten both staff well-being and patient satisfaction. Research clearly shows leadership style impacts engagement and burnout. Transformational leaders inspire and motivate, reducing emotional exhaustion. Servant leaders emphasize empathy and collaboration, improving morale and trust. In contrast, inconsistent or transactional leadership is linked to lower motivation and higher turnover. The evidence underscores why our department must change. When applied in healthcare, transformational and servant leadership foster collaboration, resilience, and reduced conflict. Staff often go above and beyond their formal roles when they feel valued. For patients, this means improved care, safety, and satisfaction. For staff, it means greater fulfillment and stronger professional growth. The benefits extend directly to the hospital. Decreasing turnover reduces costs tied to recruitment and training. Engaged staff provide higher quality care, which improves patient satisfaction scores. In time of crisis, a positive leadership climate increases adaptability and resilience. Ultimately, this change aligns with Nassau University Medical Center's mission of compassionate, patient-centered care. Strong leadership is the foundation of organizational success. By moving toward transformational and servant leadership, we can reverse trends of burnout and disengagement, improve patient care, and build a sustainable future. Simply put, investing in leadership is the most fiscally responsible and ethically sound decision. Our proposal is to implement a leadership development and wellness program. This will strengthen leadership capacity across the psychiatry department, integrating staff wellness initiatives into training. The program will be rolled out over 12 to 18 months, beginning with supervisors and managers. The program will focus on three key areas. First, transformational leadership training, helping supervisors energize and empower teams while strengthening coaching and communication. Second, servant leadership principles, prioritizing staff needs and fostering collaboration. And third, wellness and resilience strategies, supporting self-care, stress reduction, and peer support networks. Currently, leadership is largely transactional, emphasizing compliance and tasks. Our goal is to evolve toward transformational and servant leadership, where staff feel empowered, supported, and inspired. The outcome will be a leadership culture that motivates growth rather than enforces compliance. This transformation involves interactive workshops, coaching, stress management training, and resilience building. It includes tools for communication and conflict resolution, as well as mechanisms for staff empowerment and shared decision making. Together, these attributes define the change we seek. Alignment with organizational mission and values. The initiative directly aligns with Nassau University Medical Center's mission to deliver holistic, patient-centered care with dignity and respect. By enhancing staff well-being, we strengthen patient outcomes. By fostering trust and accountability, we reinforce innovation. And by positioning psychiatry as a pilot department, we can drive positive change hospital-wide. Participation will be encouraged through incentives. Leadership training will tie directly to career advancement opportunities. Recognition awards will highlight outstanding leadership. Wellness stipends will support participation in activities such as mindfulness or fitness programs, while continuing education credits will encourage ongoing professional growth. Participation and commitment. All supervisors and managers will be required to complete the leadership modules. At the same time, wellness programs will be encouraged for all staff with flexible scheduling to ensure participation. Leaders will be expected to model these practices, and accountability will be built into performance evaluations. Media communication. Communication will be key to sustaining engagement. We will use email campaigns, newsletters, and internal platforms such as Yammer and intranet posts. Infographics and short videos will provide accessible, engaging updates on program progress and benefits. Personal communication. Alongside digital communication, personal connection will remain essential. Staff meetings, town halls, and one-on-one coaching will reinforce transparency and dialogue. Open feedback forums will give staff a voice, ensuring their concerns are heard and addressed. Anticipated challenges and solutions. Of course, challenges are expected. Resistance to change is common, especially among supervisors. Funding constraints may limit resources, and time pressures for clinical staff may create scheduling conflicts. We anticipate these challenges and propose proactive solutions. Overcoming challenges. To address resistance, we will provide education on long-term benefits and ensure strong executive sponsorship. For funding, we will pursue grants and external partnerships. Training will be delivered flexibly through hybrid and online formats, reducing scheduling barriers. Expected outcomes. If successful, we expect to see increased staff morale and engagement, lower turnover and burnout rates, and improved patient satisfaction scores. Beyond internal metrics, this will strengthen Nassau University Medical Center Psychiatry reputation as a leader in patient care and staff development. Evaluation and success indicators. Success will be measured through staff engagement surveys, reductions in turnover and absenteeism, and patient satisfaction data such as HCA-HPS scores. Leadership performance evaluations will specifically measure adoption of transformational and servant leadership practices. Long-term outcomes. Long-term, we envision a culture where wellness and transformational leadership are embedded into everyday practice. The Psychiatry Department will serve as a model for other departments with a blueprint for hospital-wide replication. Ultimately, our initiative can transform not just psychiatry, but the culture of Nassau University Medical Center as a whole. In conclusion, a culture of strong leadership is essential to both staff well-being and patient care. By investing in transformational and servant leadership, we can reduce burnout, strengthen resilience, and foster trust. This initiative will not only improve the psychiatry department, but also lay the groundwork for innovation across the entire hospital.